Okay, the things to do during, okay, let's talk, we stop at the don'ts, right? So it's now the do's. So the do's are to take medications as prescribed. Even if the patient feel better, the patient should try to complete the treatment to avoid reoccurring malaria. And in not completing the treatment can also cause the patient to be resistant to the medication, even if the medication is actually what the patient needs. We talked about different type of malaria with different type of medications that work for a certain type of malaria. Do you remember we also talked about the importance of running tests before treating malaria, so that you can know the species of malaria you have, to be able to know the species of medications to use. So if you feel like you've used the medication for 2 days and you feel better, now oga will now run to work and go and spend 3 days in the office before we come back because he has felt better. All those things can cause the malaria to reoccur because it is not completely treated, and all these things can make your body resistant to that certain medications. Then get plenty of rest. Your body need energy to fight the parasites to recover. Number two, get plenty of rest. Number three, stay hydrated, take a lot of water, juice, then eat light food, nutritious meal. Don't eat if your body does not want food. That is under natural path way of treatment. Because if you are using oyibo medicine, for example, now, that one need you to eat before you can take it. But if you are using a natural means of treatment, you don't need to force your body to eat. The reason why you are not eating or why you don't feel like eating is because your body does not want it. So don't force yourself to eat. Then even if you have to, take light food. So you also need to monitor the fever and the symptoms of the patient while on the treatment to know if the patient is actually responding to the treatment or not. You can always change the type of herbs or medication that you are giving to the patient. You can always change it. It doesn't have to be one specific one. You can change your formulation. So you also do your formulation apart from the patient have been tested positive to a particular type of parasite. You can also check the patient body constitution to know if this person have excess heat or excess cold or some other things like that, for you to determine what else, what other therapy or what other treatment procedure that you can do to help the patient to respond to that treatment. This thing goes with every other patient. Do you understand? Just like we have two patients on admission, they have two different type of body constitution, their symptoms are different and they are both having the same health issue. So body constitution matters on which type of medications to recommend for your patients. Then as you are treating malaria, you must as well make sure that your environment is free from malaria mosquito. Because if you are treating and your environment is um still has mosquito and mosquito is still biting the person, it means that after that treatment mosquito can come back. The fact that you are treating malaria doesn't mean that you expose yourself to mosquito. The new bite will go and store in your liver. So after complete treatment, malaria can reoccur. So when it comes to malaria, we have different herbs for malaria, just like we have different herbs in orthodox medicine for malaria. We have some. Mommy, what herbs do you know that works for malaria? Okay, 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 okay. Mommy, mommy, honor. Mm-hmm. Oh yeah. Okay, okay. The leaf or the raw lemon and lime. Okay, okay. Mr. Duru. Oh yeah, malaria. Okay. 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 Onye, malaria, bitter leaf. Okay. What does it look like? Sandpaper. That's sandpaper. Okay, continue. I'm listening. Hey, ma'am, we are meeting for the first time. I don't know you. What's your name? Do you used to join our online class? Ah, all those names are too much. I don't even know which way again. Ah, you're welcome, ma. Did you join our previous malaria class lecture? On Sunday. Yes. The last Sunday. Yes. Okay, you joined. Okay, so you have an idea of what we are talking about. So where we talked about different type of malaria. So we stopped on the don't things you should not do while taking malaria treatment. So today now we have talked about the things you should do while taking malaria treatment. So why do you think ginger and turmeric works for malaria? Ginger improves okay. And also improves blood circulation. Okay. Both ginger and garlic. Okay. Have that, and they also have analgesic property. Okay. Okay. Yeah, mom, what about you? That's the reason. So, Mr. Duncan. Okay. Yes, ginger and turmeric, they are not direct malaria treatments. They are just like a support herbs that you can add to, just like I talk about body constitution. But in cases whereby a patient has excess yang, when you add ginger to their medication, it can cause problem because there's already heat in that person's body. Do you understand? So mostly when someone has malaria, most people do have internal cold. They'll be feeling cold, inside, while some will be feeling heat outside. Some will be feeling heat inside and hot outside. So it depends on the body constitution. So that's why you might use some certain herbs for some patients and it will not work. Why you use it for some people, it will work. So we must try to understand why this work for this and why did not work for this, and why you should select your herbs in a certain way. So turmeric is anti-inflammatory. So maybe they're experiencing body pain or aches or something. So turmeric can come in. But those two herbs, they are not directly for malaria. They can just support in treating those symptoms that comes with malaria. You mentioned something again. Neem and what ma? River lily. Okay. Lemongrass. Okay, yes. Okay, so those ones they work for malaria, yes. But we still have herbs that work effectively for malaria more than those other herbs. So we'll come to that. Did anybody mention clove? You mentioned clove. Okay. Have we talked about some patients that should not treat malaria? Okay. There are some patients, for example, a CKD patient, they should not treat malaria. When you are treating patient that has CKD health issues, they should not treat malaria because it will affect the functionality of the kidney. So when you are treating patient with chronic kidney disease, you should try as much as possible to prevent mosquito bites for them to have malaria, because no matter how much you are putting effort and the patient GFR is already low, then you now start treating malaria again, it will cause more problem. So patients with CKD should avoid malaria, and patients with heart failure too should also avoid mosquito bites, and patients with stage 4 liver disease too, F stage liver disease, they should avoid mosquito bite because at this point the liver is already weak to process the medication, and those malaria medications they are very very strong. Then pregnant women too, they should avoid some certain type of malaria medication. We can treat them, but they should avoid some certain types, especially strong herbal medication for malaria. It is better you help them to prevent it than helping them to treat it. Pregnant women and babies, especially newborn babies, at least till the first 6 months, you should not use some, don't even use herbal malaria medication for them at all. But from 6 months, you can use some certain type that are mild for them. But you can help them to prevent it. There are some apps that you can give them. So babies from day 1 to 6 months, don't give them malaria medication, but you can give them apps that can help them to prevent it, especially if they are born with maybe jaundice. They are born with jaundice. Jaundice in babies can give babies symptoms similar to malaria, high temperature, you know. That is why there are some liver medication that can also help the with malaria, because malaria begins from the liver. There is a plant that is also called Artemisia. Mom, do you know the plant? So that plant is same as um what's the English name self? I've forgotten the English name. It is also available in Africa, in sweet wormwood. That's the English name. Sweet wormwood, yes. That's the English name, but the taste is not similar to the name at all. Sweet wormwood. Sweet wormwood. So it's from this plant that they produce most ACT malaria medication, from this plant. That's why malaria medications can be very, very bitter. Very bitter. This plant is very, very bitter. Like, I don't know the whole bitter parts for this plant and bitter leaf. It's very bitter. It's effective in treating malaria. So this stands for ACT. All those artemisinin, artesunate. So this is mostly effective for treating P. falciparum parasites. We talk about different falciparum type of malaria. So, but this P. falciparum, this particular herbs or ACT is effective in treating this species of malaria. Then we talk about quinine. There is a plant called cinchona bark. This cinchona bark is a herbal plant, but from this plant we can derive quinine medications in it. There is also a plant called quinine. So these two plants, we can derive quinine. So if a patient comes to you and that patient has P. falciparum malaria too, but they don't respond to ACT, like when I used to use orthodox medication, I know the type of malaria medications that work for me. Do you understand? So if a doctor give me a certain malaria medication, it might not work for me unless I use one Zinat. That's the only type of malaria medications that work. So probably it depends on my environment, the type of species of mosquito in my environment to now determine the type of type of medication that will work on me. So anything chloroquine, metforquine, quinquine medicine, use this quinine herbs for it. That person will respond to that treatment. You might use ACT for them and it will not work for them, except you use that quinine herbs for them. CIN. Yes, cinchona, Chona, bark. It is a bark. Yes, cinchona. Yes, it's not Chinese thing. It's an English this thing. That's the name of the plant. Then we also have a plant that is also called quinine. They derive quinine medication from it too. Then we also have a particular orthodox medication that they call Coartem. It is a synthetic medication. That one is not derived from plants. That one is synthetic. It is, they mimic it to work like quinine. Do you understand? That one too is like a quinine something, but it's not this thing. It is not derived from natural herbs. Then we also have other ones too, like lumefantrine. That one is synthetic too. Then atovaquone or something. That one is synthetic too. But this particular two that I mentioned, those ones are natural. And in Africa, those are the type of malaria that is common in Africa. That is common. Then bitter leaf too. It works for malaria. But we don't know the type of malaria component that it belongs to. It actually works for malaria. Then clove, especially foreign clove or clove essential oil, because clove it has antibacterial, antifungal, antiparasite effects. I think same as bitter leaf, they have antiparasite effects, and that is why they can work for malaria. It is not that they belong to artemisinin or quinine type of malaria medication, but because of the antiparasite, because malaria is also a parasite, so it can help to take care of it. Oregano essential oil too and clove essential oil, these two, they are very, very effective in treating malaria too. Oregano essential oil is also antiparasite, antifungal. It's like an antibiotic, because malaria is also parasite infection and all that. So these two can help to take care of it too. So those two herbs too, they are also very effective in treating malaria. As in very effective, especially when you come across their essential oils, the original ones. When we talk about oregano oil, we have oregano oil. We also have oil of oregano. Oregano oil is for skincare, external use. It is not for oral use. But oil of oregano is food grade. You can use that one orally. So oregano and clove is one of my favorite herbs too for treating malaria. Oregano, O-R-E, oregano, because they can help to treat parasite and also take care of infection. Then these two herbs, when a patient have typhoid and malaria, add it to it. They treat malaria and they treat typhoid completely. When we talk about typhoid, oregano oil and clove oil, they treat typhoid completely. Not that it just curb the symptoms, so it treats it completely. You don't add oil to water. It will burn them. It will mix. You add oil to oil. You can mix it with olive oil or coconut oil. Cold pressed coconut oil. Ma? Yes. You can also use it as sublingual. Yes, ma. Oil of oregano is food grade. Oregano oil is not food grade. It's cosmetic or aromatherapy oils. So you must be very observant when you are trying to choose your oil of oregano. Don't go for oregano oil. So when you see oil of oregano, automatically you should know that it is food grade and it is very expensive. As in very, very expensive. We are talking about 60,000 here, 50 something thousand. Depends on the brand and the size of the oil. But most time it comes in as 30 ml. But you can dilute it very well. All you need to take maybe 2 drops in the morning, 2 drops in the night. So it depends on how do I put it? It depends on your malaria test too and your typhoid test. Sometimes malaria test comes with plus 1 plus 2 plus 3 plus, so it depends on the load. Then typhoid too comes 80, 120, 160, like that. So it depends on the load of the parasites in your body that would now determine if this patient treatment is going to be for 7 days, 14 days, or 21 days. But do 14 days, 21. If it is chronic, 21 days. If it is like 2 plus, you can do 14 to 21 days. If it, you don't use oregano oil and clove oil for children. Their intestine is still very fragile. You can't use it. But a child of 5, 6, or 6 thereabouts, you can do a very light dilution for them. They can use 1 drop in 2 days. You dilute 1 drop in oil that they will take for 2 days. Maybe like 4 tablespoons of oil, then you put 1 drop. You know that they'll use 4 teaspoons. You know that they'll use 1 teaspoon in the morning, 1 teaspoon in the night. So if you use 2 teaspoons, I don't want it to be too hot. That's why I'm saying 1 teaspoon. Oregano, olive oil and coconut oil can also boost immunity. So it can help to boost their immunity when they are treating it. Black seed oil too is good. But for children, original black seed oil has a peppery taste on its own. So we want to use something that is mild for children. Adults can use black seed oil. Then neem too is very effective because neem has anti-parasite effects too, antibacterial and antifungal effect. Neem works very well for malaria too. Moringa works very well for malaria too. Then brimstone too works very well for malaria too. Brimstone, we've seen that one before, and I've showed you outside before. That one that looks like malaria, that the body is shining. Yoruba used to call it oruwo. Mashibi ya Yoruba, you know oruwo. So oruwo, very effective for malaria. Very, very effective. Sir? Brimstone. Yes. It's outside. I think I've shown you before. So very, very effective for malaria. Then guava, lemongrass, papaya leaf, those ones too, they are good for malaria. Lemongrass too helps with typhoid. If a patient has typhoid too, they can use it. Then when the patient also have infections like staphylococcus, they can also use lemongrass. It's good, especially when the staph is already resistant to antibiotics. You need to introduce something calm. Okay, oh yeah, now let's talk, let's dialogue, let's talk. Calm down. I'm not going to use something wey harsh for you. Say when you don't shout for your pikin, shout for her, shout for her, you don't see here. Okay, yeah, calm down. You don't shout for your wife, go come later agree say yeah, let's calm down. Now let's do it like this. You now use moringa and lemongrass style. So lemongrass is gentle and effective at the same time. You use the tea. It's good for staph that is already resistant to antibiotics. So, and when you are talking of staphylococcus, most times staphylococcus treatment is for like 3 months, especially staph that has gotten into the blood. They have started seeing the signs, symptoms of it outside, like boil, like rashes or wound or something. You use mild treatment if it is already resistant to antibiotics. But if it is not resistant, but it is heavy, use oregano and moringa and clove. Oregano and clove for it. Very effective when it comes to staph. Staph is very difficult to treat. Very, very difficult. Because when you keep going to the hospital, they'll still continue giving you antibiotics that those things don't like. And it will now lead to Candida albicans, because the antibiotics have killed both the good and the bad bacteria in your body. So in such case too, when there's Candida albicans in a patient that has staphylococcus, because you can do tests and the test will show both Candida albicans and staphylococcus at the same time. In such case, you use clove essential oil. Clove is super duper effective for Candida albicans. But you can also give the patient clove powder to make it as tea. But in case like this, you know, we Nigerians, our head they always calculate. This way this woman give me na clove. Nothing anybody can tell me. Na clove. Don't give them only clove. Oh. Mix am with small of bitter leaf. Confuse the person. I'm coming. Always learn to confuse your patient. So even if your formula is clove that you need for that formulation, put 80% clove, put 10% bitter leaf, then put 10% onion. Confuse bitter leaf. Everything. Yes, powder clove, powder bitter leaf, powdered onion. Use the onion and the bitter leaf. It is not harmful. They shall eat onion in their house. Mix it, confuse them. I shall know say clove dey inside this thing. But wetin come make am bitter like this? Make dem go dey ask their ancestors. So that is how it must be. It's already 80% clove, but use small thing to confuse them. That confusion that will make them to come back. That medicine work, oh doctor, but just reduce small now, give me small discount. So they will end up begging you for it. Please don't forget that aspect. It is very important. It is very, very important. So clove, papaya leaf is very good. Lemongrass is good. Then when we are talking about preventive measures, herbs that you can use to prevent malaria, especially when you know that you've been bitten by malaria, but you are not positive to malaria yet, you can use lemongrass. Lemongrass tea. You can take lemongrass tea every morning. It's not harmful. It can prevent infection. You can put lime, you can put lemon in it. You can put pinch of clove. Those two things can help to prevent malaria if you have been bitten with mosquitoes, and boost your immune system too. Then there's something that Yoruba also call awopa. It's a bark. Awopa is yellowish in color. I'm coming, let me show you. Yes. Okay, the combination of bitter leaf and lemon. Sorry. Which one, ma? Morning tea, lemongrass, pinch of clove for preventive measures. No, pinch of clove and lemongrass. Papaya is used for treating malaria. Yes, both papaya leaf and the papaya itself. You can soak it in water. If do you know that malaria can get worse to the extent that it can affect the liver? So if it has gotten to the point that it has affected the liver, add sugarcane sugar in it. Sugarcane sugar is very effective in treating jaggery. Yes, add it to it. It's very effective in treating liver related issues. If someone have hepatitis or they have fatty liver or anything related to the liver, they should be on jaggery, provided you've confirmed that the patient is not diabetic. So if the patient is diabetic, you can just give them little, just little, because jaggery is very effective in treating liver issues. Then there is another plant that Yoruba people used to call egbesi. Egbesi. They use it in treating malaria too. Yes, if the malaria has affected the liver, or you can see that the person has yellowish eyes. When the eyes is yellowish, it means that the liver has been affected. And the reason why you see that when someone has malaria, your urine is very yellow is because the liver is beginning to process excess bile. So it has gotten to the liver, maybe it has stressed the liver in one way or the other. Do you understand? So the reason why you produce yellowish urine when you have malaria is because the liver is being stressed. So taking jaggery too can help. It can help. So it will regulate the. But how do we combine the jaggery and the papaya? You soak it. You soak it. Yes, yes, with the seed, put it inside keg or jar, then put jaggeries, everything will, it will dissolve. Yes, the jaggery will also prevent it from spoilage.
So, all these things that you mentioned now,
Yes, ma'am.
can it be combined together?
Yes, you can combine them, but everything I've mentioned, the quinine, the atemine, no.
No, you mentioned atemine separate of this one.
So when
All those
papaya, clove, yes, you can combine them. Depends on the type of malaria the person is having. You will now determine if your main herbs that will be of maybe like 50% or 60% will be atemine or it will be quinine. You now use those other ones to support it in helping to take care of symptoms, you understand, and also fighting the parasites. And also depends on the patient's body type. You ask, do you feel cold or do you feel heat? Do you understand? Does it happen in the evening? Malaria too can help make BP to be high. Some people, it might be that it's malaria that they have that is making their BP to go up. Do you understand? So when you now ask your patient questions, you now determine what you add to it. You can as well use only those herbs, but in the process of trying not to make your patient to get what it is, just add one or two to it. Do you understand? So that your patient will not know exactly what you are giving them. Have I answered your question, ma? So that is it. I want to show you that awokpa. It's very common. That awokpa too, they can use it for babies. Babies that have jaundice. They used to soak it in water for both pregnant women and for babies. They give them little quantity. When babies have jaundice, they put that awokpa. They used to put jaggery too with that awokpa and give babies for malaria and for jaundice. I want to show you the back. I don't know the English name. Now, Oduma teach me African medicine. Yarugbo ni o. So let me show you. It's called African yellow wood. That's the English name. This is it. The awokpa. It's yellowish in color. This is it. Awokpa. Ma'am, this is awokpa. This is it. It's not expensive. Okay, I'll send the picture.
That's the back, right?
Yes, it's a back. Yes. But go for the one that is not too dry. If you get the fresh one can even be dripping liquid like this, like yellowish liquid. So don't go for the one that is too dry. Always go for fresh one. Then you can now dry it yourself if you want to make it into powder or tea. Yes.
Okay, can you see the picture of the Egbesi?
Okay, I'll send that to Egbesi 2 is yellowish in color. I'll post it in the group. Let me go and post this one in the group for people online. That one is root, but this one is back. Epo, awokpa. But the first time that you go to the market, they might cheat you, shall just take it. Mm-hmm. So that one is epo. Anywhere you hear epo, epo means back. In Yoruba, epo means back. Egbo means root. Should I write it? Ewe means leaf. Epo, back. Egbo, root. Ewe, leaf. Eso, seed. So if you go to people that are selling herbs in the market, when you say eso, they will know that you are talking about seed. Then eso too can mean fruit. So it depends on what the seed or the sole of that plant that you want to buy looks like. Do you understand? You know, this fruit germinate from seed. So a sole means seed or fruit. Do we understand? Egbo, ewé na leaf, egbo egbesi. Then for pregnant women too, boni. Do we know boni? Boni, that's a common name too now. Boni. They use it for pregnant women too, but in very little amount of it. Well diluted. So in other African traditional medicine, this egbesi and epo kí ni mo pè lẹ́ẹ̀kan yẹn náà? Epo awọpa, that's the back of awọpa. They use it for pregnant women a lot. They also soak it with 7-Up. I don't know if you have seen malaria medicine that they soak with 7-Up before. It's because they need the sugar aspect of it. Do you understand? They mix it with 7-Up. But I prefer to use nature for nature. Then we use jaggery. So that is the inspiration behind using 7-Up to mix. Yes, epo awọpa. They use 7-Up. Then we also have lali, ewe lali. Wetin be that lali in English sef? Lali, henna leaf, HENNA, henna leaf. They use it for malaria. Please, we did not complete our water practical, right? Yes. We didn't check the pH. Yeah. Please remind me so that we can complete that practical. Then we also do practical on malaria too. Malaria tea formulation. Then we are going to take something here before we go home. No, during the practical, we will take something. Then when we get home, you will see the result. I will not say it, but everybody will come back and tell me the result. No, the malaria medicine.
That we are not. What if we don't have it?
You can prevent it. Do you know if malaria has bitten you or not? Mosquito jare. The lemongrass that you want to be taking, do you have malaria? Mommy? You don't know? So you just take it for preventive measures. Yes, children can take it, but not too strong, in a very good dilution. Yes, because lemongrass, if you come across the essential oil, it's very hot in nature. So it's hot. So you must take very good dilution for baby because of their intestine. It might not be hot in taste, but in the stomach it can be hot. If you are able to get food grade essential oil, it's perfect, but it is difficult for you to really get food grade essential oil lemongrass. But you can get food grade clove and food grade oil of oregano. But lemongrass, they don't really do the food grade like that. But you can always take the tea. It is not the main thing. It's just to complement others. Yes, just to complement those other ones. But lemongrass is very good for immunity, for parasite, for infection. It's very good. So I'm posting the egbo egbesi too in the group. You can see it's also yellowish in color, both of them. Then I was talking about henna. Henna leaf too is very good for malaria. In fact, it's one of those herbs that when you go to all this mama that is selling herbs in the market, they go put lemongrass, they go put that henna, ewe lali, they go put this egbesi, they go put this awopa, they go put all those things together for you in malaria medication, and it works very well. It works. They don't understand if you have malaria that you need artemisinin or you need clinical. They don't understand, but they combine what they have and it works. In fact, but one of the things that I don't like about buying herbs from all these people is that they don't know. Though it might work, because those other ingredients, they are superior to the grape that they add to it. They add grape.
Okay.
You see, they'll add grape, cut it, also jargon, they add it to it. But it can prevent other medications to work when you are taking grape. Yes, it blocks the liver enzymes. So it is not advisable. I don't advise adding grape to your malaria medication, or taking grape when you are taking any form of treatment. It will not work the way it's supposed to work. So I've posted those two in the group. So please, do you have any question on the malaria aspect? Taking a lot of water is also very important. Taking a lot of water. And if you're, yes, when treating malaria, because when you are treating malaria, it can affect the functionality of your kidney. So when you treat malaria frequently, it can affect the quality of your kidney.
So what if you don't have malaria and your urine is not white? What is going on?
If you don't have malaria and your urine is not white, there might be liver issue. Yes, or if you are taking B complex can also make your urine to be yellow. Yes, B complex. It's not, if it is white like this, it's dehydration. Or too much of water rather, yes. Too much, when you take too much of water, your body is too hydrated. Yes, can make your urine to be like this. Urine should be pale in color. It should not be too yellow or too diluted. There is too much of hydration too. When you are too hydrated, your kidney might be hyperactive. It can make your urine to be like this too. If it is hyperactive, just wasting everything. At the end of the day, such person might end up having vitamin deficiency, because things will not, your body will not be able to absorb what it's supposed to absorb. The kidney is just filtering everything and expelling them. So it's not good to be like this too.
My urine is kind of yellowish.
Okay.
I think I've treated malaria also.
Very yellow that you be like, see, my urine is yellow.
Yes, very yellow.
Take enough water. Then if after taking enough water for like 1 week and it still remains the same, you can go and check your liver. Your liver might be producing too much of bile. Then some certain type of food too can contribute to that. Even to your poo. Your poo can also be very, very yellow and be floating if there is a liver issue. Yes, can be floating. As in kind of yellow that you be like, normally poo is supposed to be brownish yellow, not very yellow. If it becomes very yellow, there is a liver issue too. If it becomes black, there is black can be kidney issue. Kidney issue. It should have mixture of green. It should have mixture of green. When you eat vegetable, when you eat beetroot, you see some mixtures of red. You even be scared that is there blood in your poo. So there are some certain food that you can eat that is also alter the color of your stool. So that's what I'm asking. Maybe you're on B complex or B6 or B12 or B something can make your urine to be yellow. Yellow that you be like, my person urine be this. It will be very yellow if you are taking any B related vitamins. Can make your urine to be very yellow. Then when you start taking malaria medication too, it can be very yellow too, then it will now drop. The color will now balance up. So from your urine too, you can tell if your medication is working or not, because the yellow color will now later reduce and turn to normal. And malaria can send someone to the coma. Do you know that? I've seen someone that has been to the coma before because of malaria. A very young boy, a teenager, ended up in coma because of malaria. Then steaming too is very good. Steaming, you can steam with lemongrass and bitter leaf. You can steam with neem. You can steam with that brimstone is outside there. You can steam with it too. Then that's why you need to take a lot of water when you are treating malaria. Do you understand?
Yes.
So that you not feel dehydrated. Then dehydration too can make your urine too to be yellow. Take a lot of water to dilute it.